Rich Toledo, a youth team leader for the My Brother's Keeper Sacramento Systems Navigation Series, in partnership with Kaiser Permanente and Brother Be Well. This project helps youth understand ACEs, trauma, and how to navigate public and private healthcare systems. One of the features of trauma is recurring traumatic memories. It's not easy to forget a car accident or a shooting. The youth in the program were introduced to coping strategies by clinical professionals and healing resources through Brother Be Well.
Hi, my name is Trezel White, and I learned a lot in MBK Sacramento Systems Navigation Series. One of the things that we learned about is adverse childhood experiences, also known as ACEs. In other words, negative experiences that happen to children resulting in childhood toxic stress. This carry out in adulthood? Most definitely. If we don't deal with our ACEs, they can affect our health as we get older, including our physical health. Everyone should learn to heal from trauma and also learn to deal with stress and mental health conditions to live our best lives.
ACEs can eventually impact a child to where the outcomes could be negative. So, for example, the more adverse childhood experiences one has, the more likely or the more susceptible they are to certain areas, which could be, I can just name a few of them, a lack of physical activity. So, for example, the more exposure that a child may have to that physical and emotional neglect and abuse, the more likeliness they are to experience a lack of physical activity, which can lead to smoking, alcoholism, drug abuse, missed school and work. That's another one too. So some of the outcomes that have been proven is that most of these ACEs studies, most of the youth between the ages of 0 to 5 that had the highest number of ACEs missed more school. Also, depression and suicide ideations are another factor, risk factor that could be the outcome in terms of a youth having a high number of ACEs. Also, the physical issues as well, such as diabetes and STDs. So, as you can see, adverse childhood experiences can ultimately affect the overall being of a child, and as they get older, basically those adverse childhood experiences can affect them more and more as they get older.
Happy Saturday, everyone. Justin Martinez with your Motivational Minute. I just want to remind us all today to find time to practice self-care. It's Self-Care Saturday. Wherever you are, we're in Waldport, Oregon today, finding time to take care of myself. And the why I want to do that and why it's so important, because you always want to selfishly gain care for yourself so that you could selflessly give it to your world, whoever that is, whoever that consists of. Find time to spend time with your friends, family, do a couple pull-ups, go for a jog, take a deep breath, and always remember that it's important to take care of yourself. Happy Saturday and enjoy.
Youth who have public health insurance, often referred to as Medi-Cal, need to know how to navigate the system. This program taught us how and where to get Medi-Cal, and how to advocate for ourselves in seeking the best care.
We're going over Medi-Cal today. Hello everyone, this is Nicholas Luna, everyone's favorite health insurance broker, and I get a lot of questions regarding Medi-Cal. Medi-Cal is completely different from Medicare, and it's part of Cover California, but it's still separate. Medi-Cal is emergency insurance for people who don't qualify for Cover California. Now, if you're 61 years old and younger, the primary income qualifier for Medi-Cal is just going to be straight income. Now, if you're 62 and older, they're really going to look into income and assets. And when I say assets, bank accounts, 401ks, IRA, pension plans, property. That's super, super important to know, because if you are on Medi-Cal and don't disclose that you own any property and you do get sick, the state can and will put a lien on any of your estates or property to cover the cost of your medical expenses. If you make $17,500 and less a year and you're 61 years old and younger, you're gonna qualify for Medi-Cal. So, just to recap, Medi-Cal, 61 years old and younger, less than $17,500 annual income, I can help you get started for Medi-Cal. Once you're enrolled into Medi-Cal, to renew Medi-Cal, because you do have to renew it every single year and you have to show that you're not making any more money than what you had stated when you first initially qualified for Medi-Cal, that you would have to go to your caseworker. But at least for the beginning part, I would be able to help you with that. And now if you're 62 and older, I highly recommend to go to the Department of Public Services, and they would be able to help you out to start off your Medi-Cal, because they ask you everything. And when it comes to the 62 and older part, for when it comes to Medi-Cal, I personally don't like to get involved because there's a lot of questions that they ask that I'm not very familiar with. But the Department of Public Services, they would be more than happy to help you out to see if you do qualify for Medi-Cal. Now, I hope this sheds a little bit more light and you can understand how Medi-Cal works, because it does get a little complicated, but it's there for those who need it, and especially for those who aren't able to pay for medication.
Kaiser Permanente is a private healthcare system. Youth also learned about Kaiser and how to navigate a health maintenance organization, from finding a primary care physician to accessing mental health resources. The youth have it down.
Shopping for health insurance is a big decision, but asking the right questions can make it a lot easier. When it comes to health coverage, everyone has different needs and preferences. Understanding the features of a health plan can help you pick the right match for you. Let's start with the kind of plan you want. Is it important for you to see doctors out of network or without referrals? If so, you may want to look into PPO plans. If it's not a top priority, then you may want an HMO. You'll pick a primary care physician to coordinate your care and get a network of providers to choose from. Trying to save money? Opt for a plan with a higher deductible that can be used with a health savings account to save tax-free dollars for qualified medical expenses. Or look for a plan with a tiered network. You'll save when you visit certain doctors and hospitals. This works best if your providers are already in the lowest cost tier, or if you don't mind switching. Once you figure out a plan type, you're halfway there. Now you just have to figure out the best balance of cost and coverage. There are two main types of cost: premium and out-of-pocket. Your premium is the monthly fee you pay to become a member of a health insurance plan. When you need health care, your health insurer will pay a portion of your covered health care costs, and you'll pay the rest. That's the out-of-pocket cost. This is where the balance comes in. Think about it this way. You pay your premium regardless of whether you use any service, but you only pay your out-of-pocket costs when you receive care. So if you see a lot of doctors, check the plan's out-of-pocket costs and make sure it's an amount you're comfortable with. If not, consider a plan with a higher premium so that the insurer covers a higher portion of the services you're likely to use. Find out if your plan has a deductible. This is a dollar amount you have to pay for services before your insurer starts to pay a portion of the costs. If you reach your deductible and still need more care, you and your health insurer will share costs until you reach your out-of-pocket maximum. If you reach your out-of-pocket maximum, then your health insurer will pay for all of your covered services for the remainder of the plan year. Also, look into what services apply towards the deductible and whether it covers both medical benefits and prescription drugs. Most health insurance plans include prescription drug coverage. So if you use a lot of medications, make sure those drugs are covered. Also check if the pharmacy you use is in-network and whether the plan has any special provisions, like a mandatory generic program. And if you need specialty pharmacy drugs, look into how your plan covers them. Don't forget, you can save on prescription drugs by taking advantage of generic drugs and mail order service. Questions about making your health insurance decision? We can help. We have licensed agents who are always happy to help you find the best plan for you. Call 1-888-475-6206 or visit ibx.com for more information.
Thanks for checking us out, and a big shout out to Kaiser Permanente and MBK Sacramento. And big shout out to all the community youth that participated and evaluated our mental health program. Stay up, fam, and remember, brother, be well.